And then the other piece I want to, so answer that one, but then the other piece I want us to be thinking about is, did we put the cart before the horse? My daughter's a pediatric nurse in Ohio. She got 3 clinics, so again, they never see her. She got 2 boys. But she graduated with 85 nurses, pediatric nurses, and they're so far behind. How are we going to expand whether we do it in Arkansas? Where are the doctors, where are the pharmacists, where are the clinics, where are the hospitals? How can you add that many more people to the role that we have not thought about strategically? The human side, the human service side of it. Where's the people, the resources?
Okay, can I just really quickly?
Yeah.
My husband had a patient, a child. Medicaid decided not to pay for a drug called Concerta. Okay, this child needs that medication, has severe ADHD. Well, ADHD, which is attention deficit hyperactive disorder. Sorry, attention deficit disorder. This child needed this medication. Medicaid said we're not paying for this drug anymore. Didn't notify the provider, didn't notify the parents. For 2 weeks, this child who has been medicated is no longer on his medication. It's the end of school. He disrupts the bus. He gets suspended from school. Then they try to set up an appointment with his provider that treats his ADHD, who is a physician in Searcy, Arkansas. Well, he's not in. So now we're at 3 weeks past. They finally scheduled the appointment with the doctor in Searcy over the television. UAMS has put in telemedicine. You will be seeing your physician on a television screen, and your physician will be in Little Rock, Jonesboro, maybe Conway, maybe Fayetteville, but not in Mountain View, Arkansas. That child would not sit still on the television screen because he figured it out. So he's going to act like a little monkey, which he did, and made the doctor in Searcy mad. Well, the doctor in Searcy said, well, I can't treat this patient. So what did he do? He had to call my husband to see the patient. Now, talk about craziness. That's just crazy. That's not providing health care. That's just jumping through bureaucratic hoops because, oh, this is a great thing. We've got to utilize this new wonderful technology. Are you kidding me? It's ridiculous, and that's what we're heading down. Okay, that's a little picture of what's happening right now. So 5 weeks, the child is without his medications and finally gets to see my husband, who then treats him, but then is going to have to fight just to get reimbursed for that visit. That's not, it's just ridiculous. So I just wanted to address that part of it.
Real quick, the biggest way that we can solve the Medicaid problem